Great. Thank you very much, Andrew, and afternoon, everyone. It's rather difficult. It's competing with people who are a bit like planes landing at London City when you're standing up here. I feel that they're going to land and take off, and I've got rather a small voice, so I'll have to keep at it. What I'm talking about this afternoon is personalisation's challenges to adult safeguarding. Probably you've heard that there's a lot of challenges to personalisation from adult safeguarding. We're concerned about people not being regulated when they're going to work with people in very intimate, private situations. We're concerned about exploitation. We're concerned about fraud. But I'm going to change the tack of this subject really to think about the way in which personalisation hopefully will make adult safeguarding a little bit more personalised. Because part of the problem with adult safeguarding is that it's become a bit of a process, a bit of something that people go through, and we end up with the data, the statistics, the court case, or the file on 4 case, or something like that, and it all seems a bit of an engine going ahead. But actually personalisation has got a lot to say about adult safeguarding, and of course the two were actually 2 of the 7 Ps in the government's document, A Vision for Adult Social Care. You remember they had to think very hard in the Department of Health of 7 things beginning with P, and if it went in, that was in, and personalisation was very clearly began with P, it got in there, and then everybody said, well, what about adult safeguarding? So they called it protection for about 30 seconds so it could sneak in. But really, safeguarding is what we have been urged to do in adult services for about the last 13 years, I think. So it's a small flower, safeguarding, but actually it's really important. And we know it's important because the public are concerned about it. That's why there's been all this disquiet about Winterbourne View. We know it's important because politicians really get worried by scandals. You only need to remember all the scandals in children's services to know that they haunt ministers of the time, the deaths and the tragedies that happened. And you and I know that if our families get abused or mistreated or neglected, or even in the case of my daughter, presses the wrong button when she gets an email saying, give us your bank details, how that we're all rather jittery about that at the time. So I'm going to touch on personalisation's challenges to adult safeguarding. But I could go on about this till Christmas, so I'm only going to do a small run through. Partly, of course, the problem with this area is that personalisation and safeguarding have been on rather different planets. There have been 2 groups of people who've seen it very much as their job, and they're committed, and they're both highly value-driven to say that these are important things. They're important for people at the end of life. They're important for people who are coming through transition. They're important for us as families and communities. And both of them have got their advocates and even their evangelical approaches. And they do come from different arenas. My view of adult safeguarding is that it had its roots, really, in long-stay hospital concerns. This is where the nation woke up to what was happening to people it thought were in places of safety. Nobody here is probably old enough to remember things like the Royal Commission that followed the inquiry into Ely Hospital, which strangely enough was not in Ely. This is the big problem with it. It was in Cardiff for some reason. Why they called it Ely Hospital was probably just to confuse the nation, I think. But here was the news of the world when it was a campaigning newspaper, taking pictures and having accounts of people being tied to the pillars in the ward so that they could be fed. People tied to the toilets. People beaten up as routine. And of course the nation was very concerned with that. And that, I think, is a very early depiction of why safeguarding or adult protection was so value-driven, because it was about the most vulnerable people, the people that everybody else forgot. Personalisation, we can't do a rapid history of that, but you know it's very much driven by the disability movement, people who are activists, politically engaged, but change themselves to the railings, not of the hospital ward, but to 10 Downing Street, a very different sphere. And thank goodness the 2 have come together, because in a part it didn't do anybody any good to think that there were 2 parallel debates going on, or parallel tracks. However, when you bring people together, sometimes by force or sometimes by dating systems. There are tensions, aren't they? One people thinks that everybody else has forgotten what the other is talking about, whether it's personalisation, whether it's safeguarding, because theirs is the only truth. I think in the last, say, 3 to 5 years, we've begun that dialogue, and I see the dialogue being played out at local level when people are talking about support plans which have elements of safeguarding in them, that they don't all say everything will be all right, the neighbours are universally good, there's always a nice vicar, and those sort of support plans that we've read about in a lot of the literature. Because we know there are dodgy neighbours. We know from staying at home, if anybody ever stays at home in a weekday, and instead of coming to exciting events like this, what do we get on the telephone? We get endless calls trying to sell us something, or claiming to be our bank, or claiming that we've got a PIP or something like that. I'm confused. I think, my goodness, that bank has told me something about my bank account. And then about 5 minutes later, I realise I don't have a bank account with that bank. But they have really confused me no end. And if I was at home and alone and I didn't have somebody to talk with and I'm not very naturally suspicious, I'd probably have given in to all those lottery sellers, those PIP claims people, those people who've been trying to give me get my bank details out, and so on and so forth. So we're beginning to have those dialogues both from top down and also bottom up, to say that when we're talking about personalisation and the relaxation of bureaucracy and red tape, all the things that are seen as negative, we need to manage those risks. So we in academia spend a lot of time trying to think up nice names for our study. We were terribly proud of IBSEN because it was a way of talking about individual budget services evaluation network. Very quickly, when we talked about IBSEN, some rather male researchers go for things like the SHIELD study or the SPEAR study or the nuclear bomb study or something like that. We like a little literacy and literary edge to things. We've got one going at the moment which is called LOCKS, and the other is called RSPB, which is sounds like a bird-watching organisation. So we like to have a little bit of good lightheartedness about them. But those days, when people might indeed be old enough to remember individual budgets, my children thought I was doing a study of individual budgies that the government had given to people in the country. They thought this was a great idea. All older people had a new budgie that I was going around to look and see how it was going on. But actually, of course, it wasn't. It was Cash for Care. The individual budget study, in those days called Cash for Care, now personal budgets, found that people who'd been running individual budgets and saying, let's get on with this, let's get it moving, this is something that people want and they can manage and they can make really effective choices, had sort of forgotten to tell adult safeguarding services that it was going on. They'd sort of forgotten to tell a lot of people, as it turned out. There were community nurses who denied full well that there was anything like a direct payment in their area or an individual budget because nobody had bothered to tell them, even though they were the key workers for certain clients and so on. And that, of course, is the policy integration which doesn't happen at low level. It's all very well talking about it at high level, things are going to get integrated. If you haven't spent an hour with that community nurse or the social worker or the support worker or the person on reception saying what's happening, things are doomed to fail. So we thought it was parallel tracks. We found, of course, that social workers, much as they loved to empower people and give them choices and control, would always know that families were not always the great caring networks that they could be. It's almost heresy to say so, isn't it, after Carers Week? But there is so much evidence now that not all carers have got the best interests of the person they're supporting at heart. And not all carers are equipped to manage money. Some of them find it very tempting and so on when there is money and cash about, or medication or other things like that. So while no social worker could say, I'm not quite sure about the family in public, they had files and evidence and concerns that made it important to address those risks. And then, of course, it reflected a lot of practical details, which if you do a top-down policy, you're all too busy saying get on with it before thinking about, well, what is the duty of care of the person who set up this budget? What is the duty of care in the local authority if the support worker turns out not to have the right to work in the UK? Is that the local authority's fault? Is it the employer's fault? Is it the broker who set it up? Or is it the individual employer? And as bottom-up evidence began to come through, we heard from a few people, only a few, but very influential people who are service users, about times when they had been taken to tribunals because somebody had said to them, you can hire and fire your personal assistant as you want. And they took that literally. Not meaning, of course, that employment law would apply to them, the same as it would apply to our previous speaker or to Andrew or to myself, that we all have to act under employment law. So there's always that tension, isn't there, in policy between people top down saying, get on with it, do it very quickly, and bottom up saying, but you never told us about this. So priority was given, of course, to some aspects of personalisation, particularly to direct payments, which meant that people really did have to get going on some tricky areas quite quickly. So what are the concerns that have arisen? First of all, there's that notion of a two-tier workforce. Some people do call themselves personal assistants and are personal assistants. They do it as a full-time job, 37 hours a week. They have one or two employers. They're registered for national insurance. They're in a company or whatever forms they're doing as a personal assistant. But most people receiving personal budgets don't get the money to do that. They're getting about £20 a week, and they're employing people for small amounts of time and probably under the radar. So there's cash in hand, there's sort of more informal relationships, and of course that great relaxation that used to be something that used to be a rule, thou shalt not employ thy relative, has gone in most authorities without actually any change of regulations or anything. Most authorities do not say you're not allowed to employ anybody with a blood relation. They're very relaxed about it, and how great that is. Why was it you had to employ somebody who wasn't related to you and your relative was sent out to work to enable you to find the money to pay that person? It was madness. So a two-tier workforce then has its risks. And we're seeing these played out at the moment, I think, in relation to the mid-staffs inquiry, when there's a great deal of concern about healthcare assistants. These are not the regulated bodies. People think they are, but they're a bit shadowy. Do they have a code of conduct? Who's supporting them? So much more, of course, is the person who's supporting a similar person with dementia or mental health problems or very frail in their own home. Except, of course, that individual worker doesn't have colleagues, doesn't have teams, doesn't have a supervisor, and maybe perhaps regulation is a little shadowy in that respect. So a two-tier workforce in which things like our old friends, the CRB checks, and I must alter this slide because now it's the disclosure and barring service, but those sort of checks don't have to apply. So trained people and untrained people. And you and I know that many disabled people don't like overtrained people. They say, as they used to say about NVQ, it sometimes takes the humanity out of people if you train them too much in social care. They answer the phone in a very routinized way. They do things in certain set ways because that's how they've been taught. The whole idea of personalisation is that you teach the person how you want to have your incontinence pad changed, how you want to be lifted, how you want your cup of tea, and things like that. But of course there's good untrained people or good training which is relatively helpful, and bad, isn't there? I don't want to be lifted by somebody who hasn't done a basic lifting and handling course. I don't want to have my somebody saying, that's a bit of a nasty bruise, when actually it's a pressure sore emerging. I don't want people to say, oh, well, dentures, who needs teeth, we'll just liquidise the diet. I do want some people who in my life would be trained if I was in that position. And that's the tension, isn't it, between people being trained, which may be a matter of choice, maybe cheaper, maybe more friendly, and the standards that we're thinking about for frail people. And then, of course, there's this issue about the vulnerability and isolation and open to exploitation of people using services and indeed their carers. And one of the things that we haven't really discussed much is the way in which service users can actually exploit their carers. That's another hidden subject, isn't it? It's about the idea that, well, perhaps the unmarried daughter or even the married daughter doesn't need to have an outside job. She can care for the parents and the parents-in-law. It's about the pressure on certain people, perhaps a sibling with slight learning disabilities, not to go to work, not to have a volunteer job, but to stay at home and to look after mum. And that perhaps that family dynamic that may be helpful if an outsider has a little bit more perspective on what's going on. Then, of course, in England, we have our old friend, the lack of intervention powers. In Scotland, we have the idea that the Scottish social workers and police can send in an armed raid party to your house the moment you miss a payment on your gas bill or something like that. Of course, it's not like that. But they do have very different powers of intervention in Scotland, some of which, and indeed quite a lot of safeguarding people in England, say they would like to have. They are told, of course, that there are powers if the person lacks decision-making capacity, but you and I know that somebody who's frail may have some sort of decision-making capacity, but actually be very open to pressure, to exploitation, and to all sorts of dynamics going on within their social setting. Then, of course, there's the argument that certain people are easy prey. The work we've done with the Alzheimer's Society didn't say that people with the most severe dementia are the easiest for people to exploit and neglect. Often it seemed as though it was the people who were on the slightly confused and not quite managing bit. So nobody had taken their decision-making powers and under lasting powers of attorney or the Court of Protection, but actually was open to them. And there were debates coming up about, well, they've got the right to write their personal assistant a cheque for £25,000. They've got the right to lend them the airfare. They've got the right to make them their beneficiaries in the will. Something that, of course, if you work for a regulated agency, you wouldn't be able to do. So, what did we find? We found that practitioners found it difficult to manage a policing role as well as a support role and didn't actually have much backup around it. Practitioners found it very difficult because they were getting different messages, lots of audit, lots of receipts needed, versus every flower should bloom, don't bother about receipts. And I've been around lots of authorities and I've said, well, when do you need a receipt for something you've bought? And they invent rules. There's one place which says anything over £50, we have to have a receipt. Why £50? Why not £40? No answer given. Some places say everything needs a receipt. And of course, if you mean everything, you mean everything. And people come down to the town hall with large carrier bags full of disintegrating receipts in which mice are probably nesting on a bad day. So very different messages being given out. And what, of course, you get is under-protection and over-protection in those areas. And, of course, these aren't new, and they've been very eloquently articulated, I think, by a lot of people in the consultation around No Secrets. But in the Care Bill, and I've got a copy of that in my handbag down there for a little light reading on the DLR, there's one section about direct payments and personalisation, and then another section around adult safeguarding. So we haven't entirely joined the two together yet. So why was safeguarding slightly resistant to personalisation? I think it's not just an English disease. It's the same in Scotland. It was parallel tracks or separate planets for a long time there too. Partly ambivalence. Safeguarding thought that was doing the right thing. Everybody was in favour of safeguarding. Who went around saying, I think there should be less safeguarding? It was convinced it was doing the right thing. Winterbourne View, I have to say, has really woken up the safeguarding community. If you work in safeguarding, you probably looked at that serious case review and thought, oh my goodness, there, but for the grace of God, went my local outsourced services, the people who are rural and remote in my place, and so on and so forth. It wasn't that South Gloucestershire was any worse, probably, than most of the safeguarding services I've seen. I think they knew things were happening, but it wasn't always top of their priority, and nobody had engaged with them in setting up this enormous care facility in the middle of a field in their patch. Likewise, safeguarding is overloaded. I sometimes talk to people who talk about the safeguarding service as if it's a new block of the town hall, that there's a tower block staffed by people answering phones, doing investigations, looking at poor practice, looking at carpets that are slightly ruffled or anything like that, looking for work. Whereas actually, if you talk to safeguarding personnel, they're often out because there is one of them. It's a woman and a dog or a woman and a clerical assistant, and that's it. There is no giant safeguarding system in most local authorities. And indeed, if you go to your health service trusts, there may be somebody with safeguarding in their job title, but they've probably got 113 other responsibilities as well, which happen to be things like budget and quality and other things like that. So perhaps some overload in the system, and indeed a way in which safeguarding over the last 13 years since No Secrets came out has had to grow itself with no budget, no legislation, no idea of the model it should be adopting. And then, of course, with the idea about individual budgets, certainly, for a long while we were told that this was a pilot, that it was going to be looked at. And if you're looking at pilots, they're not the top of your list, are they? They might come, they might go. It might be just a trend, a glint in a minister's eye, and so on. So you're not always sure that that's going to be there forever. And then, of course, part of the problems with adult social care is that it's not only got to deal with adults receiving social care and safeguarding issues, but the safeguarding people have to look at hospitals, have to look at prisons, have to look at all the other community facilities as well. So overload increases. So what are the practice implications for all this? I think there's a few. The first for people in personalisation is to get on side with safeguarding. They aren't the great enemies. They're the ones who would like personalised approaches when things go wrong with people in other settings. Think, for example, a way in which a personal budget could be used to buy the art therapy for somebody who in young adulthood begins to disclose childhood sexual abuse. How wonderful it would be to be able to say, I can purchase that, I know who can do it, we'll do it through a direct payment so we don't have to have contracts and things like that. And let's think of this as part of the support plan. And indeed for safeguarding, they've been rather pushed to do the assessment and the investigations and have often found it very difficult to find any resources to do the recovery and the healing after it. So just think to yourself about who is going to be able to do the healing work for people who were involved in Winterbourne View, either as the patients themselves, particularly for the families who I think will need help with healing and what has gone wrong with them, but also for the staff who weren't involved, or maybe who also felt, oh my goodness, I should have done something, and the trauma that they may be going through at the moment. So a personal budget is a great way to be able to respond. The first bit of money we've had, other than personal health budgets perhaps, to be able to make that quick individualised difference around response. Then, of course, we can ensure that people get support after they've disclosed, after something untoward has happened, and so on and so forth, and to then address further risks of harm. One of the really awful things we learned from long care, which people might remember was another home where people were placed out of area quite a lot, was that when people were removed from long care, they went to institutions and were further abused. And how awful that was. No such thing as a place of safety. Nobody really thinking what their needs, how their needs could best be met. So personalised support can also be preventive. I know of one case, somebody talked to me about a support plan whereby the person who was offering support to the grandmother was a young grandson with a criminal record as long as your arm. And that person, everybody knew the risks, grandma knew the risks, and built into the support plan was the view that every week an independent person would come and talk to grandma and the son and the grandson wouldn't be there. How fantastic that was. She got what she wanted, the grandson got a job, which presumably he was never going to get anywhere else, and actually that began, I think, to promote a healing relationship and some good outcomes for everybody concerned. We need to enlarge the alerting systems. What does it mean for a personal assistant to raise an alert? I haven't seen any information which says, personal assistant, you too need to know when things go wrong, when people are getting harassed by people trying to sell them things, and strange people keep doing things on people's roofs and so on. Let's talk to them rather than seeing them as a problem, see them as part of the solution. We, of course, need to weigh up the value of checks. The checking system is changing, but there is a deal of pressure that believes that a good check is a preventative device. It is part of it, but it isn't the only bit. And of course, many people say that if you've got a positive criminal history, it just means that you've got caught. What we really need to do is find out the people who didn't. We need, of course, to learn from experience. We've learned from the experience of one tragic case where a man with direct payments was murdered by his son, and nobody knew what was happening around direct payments in that particular issue. We need to learn from that. What was the problem there? Obviously the son in some respects, but equally the fact that monitoring and reviewing did not happen in that case. And there is a whole chapter and a chronology of what didn't happen, the sort of holes in the Swiss cheese that we talk about when we think about serious incidents for children, domestic homicide and other serious case reviews. And we need to offer training and tasters. And I commend to you places like Greenwich Carers Centre, which offers support for personal assistance through the form of a coffee morning. It doesn't have training written all over it. It has coffee and tea. And I think people come because of that. So the next point is we need to learn from personal assistants and to get our idea about who they are. Some of them are very local, some of them are relatives, some of them are people who've been around in social care for a long time. But a colleague of mine has just done interviews with 32 personal assistants working in London. And here is somebody who is rather typical of the people she spoke to. This woman, Nicole, we'll call her. Nicole rents her house in South Africa to tourists for half the year. She goes to the UK when the tourists are in her house and works here as a personal live-in assistant. Then she goes home. So that's quite a nice lifestyle, isn't it, you would think. We don't know much about Nicole. She doesn't appear on any social care register. We don't know how the live-in arrangement happened. How did somebody employ somebody from South Africa to move into their own house? So this new world of transactions, and it's a world, not just a locality. So we're beginning to find out more about personal assistants and particularly live-in care assistants, very, very common in the European mainland, and how they work. And again, has anybody ever talked to Nicole about the needs of the person she's supporting, about what to do if she thinks that something's going wrong? We didn't find any evidence that Nicole had picked that up. So as I've said, we need to offer support for personal assistants, ranges of support, networks, personal contacts, introductions. And those of you who worked in children's areas will know that these things happen for au pairs, for nannies, for everybody else who's slightly in an unregulated domestic setting. They perhaps have forums, or maybe just call them coffee mornings. Perhaps some long-arm supervision for people who perhaps have committed to this work as a career, and certainly information for people using personal budgets about their employer rights and responsibilities. I don't know if you have tried to see whether or not somebody has the right to work for you. I'd have to do it at the university. I have to take so many copies of their passport that it probably wears it out. And pages of people's passport, and the back and the front and things like that. It's quite a complicated business at the moment. So progress there is. Undoubtedly, personalisation and safeguarding are talking the same language, often in the same room and often to each other. We're thinking about publicity and information to make people aware of things, using things like the free local newspaper as well as social media. How to respond to allegations using a social marketing approach, thinking about training, information and advice for people using personal budgets, and also who are the groups to influence locally. You and I have probably worked around communities for so long, we know who the key people are. In my area, it was, when I worked in a community development project, it was the woman who ran the corner shop. It was her who knew everything, and if she didn't know it, she knew the person who did. So those key informants are important to remember. So just to end with a few illustrative examples, I thought this was quite an interesting headline in Community Care. If you can't read it, it is "Social Worker Failed to Monitor Direct Payment User Murdered by Son." Now, who was murdered? Was it the social worker? Or was it the direct payment user? It's a little ambiguous. I'm going to put your mind at rest. It was, in fact, sadly, the direct payment user. But this is the power of just making sure that you get your headlines to mean what you think they mean. Here is an extract from the serious case review that you may be able to read, but it just highlights the way in which the oversight of public funds, and that, of course, is what a personal budget is, by Buckinghamshire Adult Social Care. This is a public document, so I'm not naming names out of order. It appears that Mr. C received direct payments which he didn't use for the purposes intended, i.e. no monitoring, very little reviewing. His son continued to access these, so no suspicion that there was any problems with that relationship, and it's not known what happened to the money. Social services thought there were some people employed, they never found them. Although direct payment recipients can be offered flexibility in what they want to purchase, this local authority has a duty to ensure the money is spent for the purpose intended. Mr. C's circumstances indicate that duty was not enacted effectively in Buckinghamshire. So you always know what reports are saying, don't you? Very moderate language, slightly couched in polite terms. But I think we get the sense here that maybe there was a bad apple, but equally perhaps the barrel was lacking in its robustness and the way in which it was constructed. So I'm going to end there by thanking everybody very much who's participated in the research on which this builds. I always, at the end of any session, have to say that the views in this article the views expressed in this presentation are those, of course, of the research team and not of the Department of Health.